Conservative MLA and critic for rural and seniors health, Brennan Day, says he's heard numerous stories similar to the one we reported on Saturday.
I think the ministry needs to do a serious review of this system to make sure it's working, but right now it's clearly not.
On Saturday, we met Nigel Poulton, a Woss man who needed a ride to a specialist appointment in Victoria in April and was surprised that Island Health sent him a cab. He had suggested to save money that a volunteer could drive him down for the cost of mileage at the government rate of about 61 cents a kilometre or a total of $488. But Island Health said no. In the end, the cab cost over $1,100 each way, as these pictures of the meter show, even at a flat Island Health rate.
I figured make it a choice. I mean, I'm not saying cancel the program, but give, if someone's willing to have a friend drive them down or a volunteer drive them down, pay their mileage.
Day says part of the problem is that a service of volunteer drivers called Wheels for Wellness in Comox that covered the island didn't bid on the contract again because the Ministry of Health, he says, wasn't going to pay enough to cover the gas.
We raised this issue with the ministry back in December when they decided to pause the contract with Wheels for Wellness. And we were assured by the ministry there wouldn't be any issues going forward with patient transportation needs in the north. Since then, we've had multiple reports of taxi cabs being used as a Band-Aid solution.
That Wheels for Wellness contract is now covered by 10 service providers, but Day says not to the same capacity and that there's a backlog of rides to the end of June. Meanwhile, the owner of Angel Flight BC in Sydney says his volunteer pilots fly sick people to appointments for free, but that he has been turned down when he approached the BC government for assistance.
We pay for our fuel costs and incidentals. I take home zero. So it's not as if we squander money or anything like that. And the BC government don't want to know.
In response today, Island Health says its travel assistance program for non-emergency medical care is specifically to support people who have exhausted all potential options and do not have any way to travel out of community for a medical appointment, adding it is not a reimbursement program for people who have family and friends who are willing or able to drive them. It also says currently there is no backlog of bookings and rides are available to people calling into the call center.